this has raised concerns whether this variant in India, the second wave, is killing more people. Why is it that there are more and more people, in fact, dying because of the COVID-19 virus? Massive, in fact, related to this story, massive concerns have also been raised about doctors and paramedical staff which is falling prey to COVID-19. A renowned doctor, KK Agarwal, who was the former head of the Indian Medical Association, today passed away after 21 days fight against coronavirus. 269 doctors so far have lost their lives battling this virus on the front lines. Why is this virus being so deadly, and why are doctors in such huge numbers being infected and are dying despite the vaccination? Take a look at this story, then we'll get you some experts to speak about this.
Dr. KK Agarwal, one of India's most prominent face of medical fraternity, is no more. The former president of the Indian Medical Association lost his battle for life to the deadly COVID-19. The 62-year-old was admitted at Delhi's AIIMS hospital few days back and was put on ventilator last week. But unfortunately, he could not survive. He breathed his last at 11:30 p.m. on Monday. His family put out a statement saying that KK Agarwal wanted his life to be celebrated and not mourned. The family said that ex-IMA chief dedicated his life to the welfare of the public since he became a doctor, and also reached out to millions during the pandemics and saved countless lives. KK Agarwal was a man of great grit and determination, and this video is a testimony to his indomitable spirit.
Picture abhi baki hai, the show must go on. I represents the collective consciousness of the medical profession. Even I am suffering from COVID. I am having COVID pneumonia, which is progressive. But even then, remember Raj Kapoor's word, the show must go on. Picture abhi baki hai.
The Indian Medical Association is also mourning the death of its former president. The eminent cardiologist had got both doses of vaccine but could not survive.
Today we have lost one of the great leader of Indian Medical Association, Dr. KK Agarwal, who has been fully vaccinated, but still he has get into trouble, and so there is no absolute full proof that you will not get an infection.
KK Agarwal was also the head of the Heart Care Foundation of India. He received the Padma Shri in 2010 for his work in the field of healthcare. KK Agarwal's death has created a huge void in the Indian medical fraternity. Bureau Report, India Today.
Why are doctors, despite being vaccinated, getting impacted in such a huge number, and why is the death toll so high in the second wave of coronavirus? To quickly discuss this, I have Dr. Vishakha Shivdasani, critical care physician and author of COVID and post-COVID recovery. Dr. Sameet Gupta, Director Cardiology, Metro Group of Hospitals, is also joining us. Thank you so much to both of you for sparing the time out and coming here on India Today. I want to understand from you, Dr. Shivdasani, we have been seeing India posting very scary numbers as far as the deaths are concerned. More than 4,300 deaths have been reported in the last 24 hours. Is there this second wave of the variant that is prevalent in India causing more deaths? Why are the numbers so high? While the overall numbers are dipping, the number of deaths are only increasing.
I think it's important to understand that this virus has mutated, like we know. There is a double mutation, triple mutation, and that is the natural evolution of a virus. It will either mutate to be stronger or to be less virulent. Clearly, in this case, in the second wave, it has gotten more virulent. The R value is more. So the rate of transmission also is higher. And doctors are constantly also, as far as doctors are concerned, exposed in the hospital, in the ICUs, to a very high viral load. So like Dr. KK Agarwal also sadly succumbed, and my personal condolence, I think he was a fantastic teacher. You know, he was also working till the end. He also had comorbidities. So as far as this virus is concerned, this mutation is concerned, A, it could be mutation. B, we need to understand that, as Lancet has recently written, this is not only a droplet infection, it's also an aerosol infection, which means even the social distancing in itself is not enough. While it's crucial to maintain it, it's not enough. So it's spreading rampantly. It also seems to be affecting people under 40, like you said, in the second wave. So it's a cumulative effect of the mutation,
Yes.
of the fact that it is it's not just a droplet infection, and that it's affecting younger people. And younger people, it's also affecting where the need for oxygenation clearly in this wave is much higher. It's affecting the lungs faster.
Okay. 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 Dr. Gupta, is there a difference that you have also noticed between the first and the second wave, and anything in particular that can be attributed to this high rate of deaths which are being recorded in the country?
I think this is a question all the entire medical fraternity is actually battling with. One thing which is certainly we are seeing in our clinical practice is that the virus seems to be more transmissible and more virulent. Previously in the last wave, if one person in the family had it, the R value was such that the transmissibility was much lesser. So, maybe if one person had it in a family of 5, maybe 2 people or 3 people in the family got it. Now, with this new variant, what we're seeing is that if one person in the family has it, directly or indirectly, the entire household gets affected. And so the case numbers have really gone up dramatically because of that. And also the people who are getting sick are getting very, very sick. Now, when you add that, when you compound the more number of people who are getting infected, and even though the percentage of deaths may not be that different, the sheer volume of cases increases your total number of people who are dying. Because of the sheer volume of cases that has come up, the medical infrastructure has been drastically challenged, and they're not able to get the treatment that they should get, the patient should get. And because of lack of treatment in many patients, we are seeing these stories. Also, there is a very high death rate. So I think it's a compounding effect of the virulence of the virus, compounded with the lack of healthcare infrastructure available and the lack of ability to get good treatment that is increasing the death toll.
May I just also for a moment bring the attention of both of you and our viewers onto this graphic that I'm putting out on the screens, which tells you the number of beds which are available in Delhi. Just for an example, if you take a look, the oxygen beds which were, for a couple of weeks back, it was very, very difficult to get an oxygen bed in Delhi. Right now, there are about 10,388 oxygen beds which are vacant. But if you look at the ICU beds, only 1,013 ICU beds are vacant. And if you take a look at the ventilator beds, it is only 197 ventilator beds which are available in Delhi. Dr. Shivdasani, I just wanted to put this out for a moment to understand the ventilator beds in the last few days, as demand for the oxygen beds has come down. The ICU beds and the ventilator beds demand is still very high. Does this mean that the patients who are coming for medical treatment are possibly coming in late, and they are coming in serious conditions? That is why it is difficult to manage these patients and the deaths are high?
So I think in the second wave, what is happening, the presentation of the illness has changed. Initially, the first week was just, but the disease typically lasts for about 2 weeks. And the first week is the viremia, where, the virus replicates in the body. The second week is when the inflammation really happens. In this wave, we are seeing that the first wave has shortened, and the inflammation is actually happening at the end of the first week, at 4 days or 5 days, instead of that 7-8 days. And by the time the patient actually presents himself or herself to hospital, it's a tad too late. And they are reaching at a point where they require not just oxygen, but, the ICU bed, because the inflammatory markers have gone through the roof, the D-dimers have gone through the roof, IL-6 markers, and they are reaching a little later because we are testing probably at different times now.
Does this, Dr. Gupta, now require some sort of a different guideline? Initially, the assessment was that it is only after possibly 7th to 11th day when people were requiring hospitalization, or that was the danger period. Does it now need to be hasten up a little bit, possibly get patients admitted slightly earlier than we were doing in the first wave?
So, I think I would like to add to what the other doctor said. What is happening is a lot of people are coming in late. There is this thought in the mind of the person that, maybe I can treat myself at home and not go to the hospital at all, because now I have the oxygen concentrator. What else are they going to do? And when these people crash, they want ICU beds. Right. So that is what I think is happening. The other thing that is happening is that there is a delay from our lockdown effect to what we are seeing right now. Right. So those people, the lockdown takes a little, we are lagging by 2 weeks in terms of the sheer illness. So we are seeing that those people who got infected 2 weeks ago or 15 days ago or 10 days ago, they are the ones who require ICU right now. I do agree that we are seeing a lot of people who are decompensating earlier than what was seen previously, around the 10th day, 11th day mark. But I think it's important that whoever is treating themselves at home, they be in a very close contact with a medical physician. They get themselves checked regularly. They share their vitals regularly. So at the first hint of getting sick or things not going as planned, or you rush to a hospital and get admitted.
Right.
So maybe with more aggressive treatment, we may be able to reduce the requirement for an ICU in that population.
Dr. Shivdasani, a lot of people are raising this question. I don't know whether there is a straight answer to it or not, especially when it comes to the medical professionals, doctors and paramedics, that despite getting vaccinated 1 dose, 2 dose, there are still doctors, those who are dying in the line of duty. Do you see any kind of fears as far as the common people are concerned? I mean, once again, some kind of vaccine hesitancy, that despite doctors getting vaccinated, if they are dying, why should we go and get ourselves vaccinated? What are the reasons you attribute to that?
Well, first of all, let's understand a common man is not exposed to the virus as much as a frontline worker, whether it's a doctor or a paramedic is. So it's not like these doctors go into hospitals, go into ICUs 24/7, are constantly exposed to COVID patients. It's very different from a common man. And despite that, if you look at the percentages, they're still very, very small. So I don't think the common man should be afraid of taking the vaccine at all. And I say this all the time. Whoever is eligible must take the vaccine. Some immunity is better than no immunity. On a large scale, we do see that the protection that a person gets after this two weeks, after the second dose, is to a point where at least you don't reach hospital. We take a few cases and we exaggerate those and we start analyzing those. But please see things in perspective and see things in, the percentage of numbers. And they are still minuscule. Do they happen? Yes, they do. But we don't know. Like in Dr. Agarwal's case, from what I understand, he also had multiple comorbidities. So we also need to see all of that. We can't just pick a few cases and say that because XYZ person succumbed, I'm not going to take it. It is offering huge, they do have, these studies have been done, right? The efficacy is there. Yes, we can have a vaccine escape. Yes, we can have an immune escape because, like I said, that's what viruses do. But despite all of that, the protection is there. Let's not take away from that.
Okay. All right. It's important for people to understand that doctors are constantly exposed. The viral load that they face is unparalleled. I mean, it's day in, day out that they have been, in fact, treating COVID patients in the ICUs, taking wards, doing rounds in the COVID wards. So their case is completely different. And it's very, very painful to see, in fact, our frontline warriors succumbing to COVID, but that should not stop anybody from taking or trying to get vaccinated. Thank you so much, Dr. Gupta, Dr. Shivdasani, for speaking to India Today and giving us more clarity on the high death rate as far as the country right now is still in midst of a very virulent, very violent second wave of the coronavirus.